Good morning, everyone. My name is Jessica Koth, and I'm the Public Relations Director for the National Funeral Directors Association. As you can imagine, the welcome here to our Facebook Live broadcast, a conversation with the CDC, funeral service, and COVID-19. As you can imagine, the staff at the CDC have been incredibly busy helping our country stay safe during this COVID-19 pandemic. We are immensely grateful to them for all of the information they've been sharing with us, the information that we've been happy to pass along to you, the funeral service community, via our NFDA COVID-19 information page, as well as on social media and via email. So we're thankful that in the midst of everything that is going on, that they were able to carve out some time today to speak directly to you and to share some information with you that's going to be helpful as you go out and serve families. So with that, I'd like to introduce our presenters and then turn the floor over to them. We are honored to be joined by Captain Jill Sugart. She is with the National Institute for Occupational Safety and Healthcare at the Centers for Disease Control and Prevention. Captain Sugart is working on the Worker Safety and Health team for the CDC's COVID-19 response. Dr. Sarah Reagan Steiner is a medical officer with the Infectious Diseases Pathology Branch at the CDC. And Dr. David Berendez is an environmental epidemiologist with the Community Interventions Task Force and the Waterborne Disease Prevention Branch of the CDC. Welcome, and please, the floor is yours.
Great. Hello, everyone. This is Captain Jill Sugart. I want to thank you, Jessica, and thank you to the National Funeral Directors Association for the opportunity to speak today. We really appreciate the efforts you are undertaking to keep your communities and your workers safe. I wanted to provide a brief situational summary of the COVID-19 outbreak. As you are aware, CDC is responding to an outbreak of respiratory disease caused by a new coronavirus that was first detected in China, and per the World Health Organization Global Summary, there are more than 132,000 confirmed cases of COVID-19 in more than 120 locations worldwide. The virus that causes coronavirus disease 2019, or COVID-19, is infecting people and spreading easily from person to person. Cases have been detected in most countries worldwide, and community spread is being detected in a growing number of countries. On March 11th, the COVID-19 outbreak was characterized as a pandemic by the World Health Organization. Pandemics occur when a new virus emerges to infect people and can spread between people sustainably. Because there was little to no pre-existing immunity against the new virus, it spreads worldwide. CDC and state and local public health laboratories are testing for the virus that causes COVID-19. CDC has developed a map of the US that shows affected states and how many COVID-19 cases they have reported. Because states are reporting their results directly and publicly, sometimes in near real time, CDC case counts may be different from what states, local authorities, or media are reporting. In the event of a discrepancy between case counts reported by state or local public health officials versus CDC reported numbers, the numbers reported by states should be considered the most up-to-date. The CDC website is updated regularly at noon, Mondays through Fridays. Numbers close out at 4 p.m. the day before reporting. As of March 14th, there were 2,226 total confirmed and presumptive U.S. cases, 50 total U.S. deaths reported to CDC, 47 jurisdictions reporting cases, 46 states and the District of Columbia. CDC recommends.
If I could just interrupt for a moment, would it be able, would you be able to get a little bit closer to your microphone? It seems like we're experiencing some audio difficulties for our viewers.
Oh, sure.
Thank you.
Try this, see if this helps. CDC recommends individuals and communities familiarize themselves with recommendations to protect themselves and their community from getting and spreading respiratory illnesses like COVID-19. Older people and people with severe chronic conditions should take special precautions because they are at higher risk of developing serious COVID-19 illness. Please refer to the CDC COVID-19 website for the most up-to-date information. This is a rapidly evolving outbreak, and the website is updated regularly. I'll now turn it over to my colleagues to provide a brief overview of the CDC post-mortem guidance and the interim mass gathering guidance, and then we'll move to the Q&A portion. Please note that my colleagues and I will be sharing our updated guidance today. We want to provide useful tools, and we welcome your feedback. For example, if there are gaps in our guidance or our Q&As, please let us know if we need to add information on a specific topic or if a fact sheet would be helpful. You can send ideas by submitting your comments in the chat box of this webinar, and we will be able to review afterwards. I'll now hand it over to Dr. Sarah Reagan-Steiner.
Thank you, Captain Sugart. Thank you for the opportunity to join this webinar. In February 2020, CDC posted interim guidance for collection and submission of postmortem specimens from deceased persons under investigation for COVID-19. This guidance was developed to guide medical examiners, coroners, and pathologists in what specimens can be collected post-mortem, including during autopsy, for the evaluation of SARS-CoV-2, the virus that causes COVID-19, and how these specimens can be safely collected and handled. While you may not use the parts of this guidance in your daily practice, we wanted you to be aware of this resource, given you may work closely with medical examiners and coroners in your community. And additionally, some of the principles included can be applied to the funeral service setting. Next, I'm going to hand it back to Captain Sugart to review some of these aspects as it relates to worker safety.
Great, thank you very much. I wanted to just go through the guidance just very briefly to point out some specific worker safety and health precautions that I wanted to make you aware of. So as Sarah mentioned, this guidance really is for the collection and submission of postmortem specimens from diseased persons under investigation for COVID-19. And in order to collect those specimens safely, we wanted to make you aware of some specific biosafety and infection control practices. If you have taken a look at the guidance, you'll notice that it's divided up into a few sections. The first part of the biosafety and infection control practices discusses how to collect postmortem upper respiratory tract swab specimens, which we do not view as an aerosol generating procedure. Therefore, the engineering control recommendations and the personal protective equipment or PPE recommendations are there, indicating that you should follow standard precautions while collecting those specimens. Furthermore, the second piece of that biosafety and infection control practices section then moves on to autopsy procedures, which we do consider an aerosol generating procedure, or AGPs, and we have some more strict precautions in that section, and that's why you'll see not only how to perform safely those procedures, but some specific engineering control recommendations and also some PPE recommendations that are a little more stringent for that environment, including having respiratory protection. I also wanted to point out that we do include a section on cleaning and waste disposal, so how to properly clean the environment after you have performed the work that you need to do to collect these specimens. And then the final section of this guidance document is dedicated to transportation of human remains. So again, after that work has been done and those specimens need to be shipped and transported, how do you clean and disinfect the body bag during transport? That wraps up the main pieces of those biosafety and infection control practices that I just wanted to point out in the guidance. Again, as mentioned, that guidance is available on the CDC website, and I think we're going to be following up with all of the links that we're going to be talking about today. Next, I wanted to move to a series of questions and answers that we have developed. CDC has provided guidance on coronavirus disease 2019 and funerals. So this is a series of answers to frequently asked questions that is also available on the CDC website. And I wanted to make you aware of this information and just highlight a couple of key points to make sure that everyone is operating with the information that we have current as of today. There is currently no known risk associated with being in the same room at a funeral or visitation service with the body of someone who died of coronavirus disease 2019 or COVID-19. COVID-19 is a new disease, and we are still learning how it spreads. The virus that causes COVID-19 is thought to mainly spread from close contact with a person who is currently sick with COVID-19. The virus likely spreads primarily through respiratory droplets produced when an infected person coughs or sneezes, similar to how influenza and other respiratory infections spread. These droplets can land in the mouth or noses of people who are nearby or possibly be inhaled into the lungs. This type of spread is not a concern after death. It may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it and then touching their own mouth, nose, or possibly their eyes. But this is not thought to be the main way that the virus spreads. People should consider not touching the body of someone who has died of COVID-19. Older people and people of all ages with severe underlying health conditions are at higher risk of developing serious COVID-19 illness. There may be less of a chance of the virus spreading from certain types of touching, such as holding the hand or hugging after the body has been prepared for viewing. Other activities, such as kissing, washing, and shrouding, should be avoided before, during, and after the body has been prepared, if possible. If washing the body or shrouding are important religious or cultural practices, families are encouraged to work with their community, cultural, and religious leaders and funeral home staff on how to reduce their exposure as much as possible. At a minimum, people conducting these activities should wear disposable gloves. If splashing of fluids is expected, additional personal protective equipment may be required, such as a disposable gown, face shield, or goggles and a face mask. A funeral or visitation service can be held for a person who has died of COVID-19. Funeral home workers should follow their routine infection prevention and control precautions when handling a decedent who died of COVID-19. Embalming can be conducted. Decedents with COVID-19 can be buried or cremated, but check for any additional state and local requirements that may dictate the handling and disposition of the remains of individuals who have died of certain infectious diseases. Finally, if a family member dies from COVID-19 while overseas, the deceased person's next of kin or legal representative should notify U.S. consular officials at the Department of State. CDC does not require an autopsy before the remains of a person who died overseas are returned to the United States. Depending on the circumstances surrounding the death, some countries may require an autopsy. More information about the requirements for returning a body to the United States are available on the CDC website. Now I'd like to turn it over to Dr. David Berendez.
Thanks for the opportunity to speak. So due to the COVID-19 national emergency, CDC, in accordance with our guidance for large event and mass gatherings, recommends that for the next 8 weeks, organizers, whether those are groups or individuals, cancel or postpone in-person events that consist of 50 people or more throughout the U.S. As with any new public health issue, our role is to couple the best available evidence about the current situation with data and lessons learned from previous experience. The ultimate goal is to save lives. Limiting events to 50 or fewer people provides a balance between allowing critical activities to continue and promoting controlled environments where social distancing, proper hygiene, and protection of vulnerable populations can be reasonably expected. We realize this may apply to large funerals and therefore your constituents may be affected. As of now, this guidance only applies for the next 8 weeks. During that time, we encourage alternative options to in-person gatherings of 50 or more people. For example, if live streaming and limiting in-person attendance to immediate family is possible, we encourage that. Additionally, promoting social distancing at the event, regardless of size, promoting hand hygiene as well, is also important. Finally, consider staggering events. For example, if multiple funerals are planned in a day, stagger those to limit the size of events. Additionally, I know there was some considerations around the guidance of 10 or more, of limiting congregations of 10 or more high-risk individuals, and I want to note that that guidance is not necessarily supposed to be applied to funeral homes because it was primarily geared for older care or other settings that are specifically for high-risk individuals. But again, as with the other principles I discussed, social distancing, hand hygiene, and other common sense measures would apply to those events, and you may consider limiting the number of high-risk individuals who are attending the event to those who are absolutely necessary. And with that, I'll turn it back over.
Great, thanks so much. And now we'd like to hand it over to Jessica with NFDA to moderate the Q&A.
Great, thank you. I think sort of this last piece of information about the new guidance about mass gatherings has been really important to folks who are listening into this, because that, you know, with that new guidance coming out late yesterday, that was certainly something that folks were really curious about. So we will get more information up about this on our NFDA COVID-19 page as soon as we can today. But yes, we do have some questions. We've been getting a lot of questions over the last week or more from our members. So I'm thankful that you're able to take some time to answer that. One of the most common questions we've been getting is how long does the virus remain active and virulent after death? And also, how long does it stay active on surfaces? Can you talk a little bit to that?
Sure, this is Captain Sugart. COVID-19 is a new disease, and we are still learning how it spreads. the severity of illness it causes, and to what extent it may spread in the United States. Current evidence suggests that novel coronavirus may remain viable for hours to days on surfaces made from a variety of materials. For example, recent literature has suggested that the virus can survive on porous surfaces such as cardboard up to 24 hours and for days on non-porous surfaces such as stainless steel. Cleaning of visibly dirty surfaces followed by disinfection is a best practice measure for prevention of COVID-19 and other viral respiratory illnesses in community settings. There is information on the CDC website for specific recommendations on environmental cleaning and disinfection for various non-healthcare settings, including community facilities, schools, and businesses.
Great, thank you. I know we talked earlier a little bit about the importance of PPE and using that proper personal protective equipment. One of the big concerns we've heard from our members is the availability of PPE and how, as this continues on, how the federal government is going to prioritize distribution of PPE. So can you speak a little bit about that and where funeral directors fall on the list for the priority distribution?
Sure. So the outbreak of COVID-19 has led to a disruption in the global supply chain of personal protective equipment, particularly of N95 respirators. CDC recognizes that facilities may experience temporary shortages even if they do not care for patients or handle patients with COVID-19. CDC encourages facilities to review strategies for facilities to optimize their N95 use. However, if your facility is concerned about a potential or imminent shortage of PPE, CDC recommends you alert your state health department and local healthcare coalition, as they are best positioned to help facilities troubleshoot through temporary shortages. I also wanted to point out that CDC NIOSH has a strategies for optimizing the supply of N95 respirators document on the CDC website. I think we're going to try to get that into the chat box for you. I'm not sure if you've seen that, but that would be a really excellent resource for you as you're trying to look at your PPE inventories and determine your status.
Yep, and I think we have those links, so we'll make sure that we share those on our COVID-19 information page.
Great.
So in lieu of disposable masks, what kind of alternatives to the N95 respirators is the CDC recommending?
So CDC has released guidance on ways to optimize supplies of N95 filtering face piece respirators in healthcare settings and non-healthcare settings in the face of potential ongoing coronavirus disease 2019 transmission in the United States. So the guidance that I just referenced also includes information about the use of alternatives to N95s. This is in the strategies for optimizing the supply of N95s. So we do have alternatives to N95s that can be used where feasible. These include other classes of filtering face piece respirators, elastomeric half mask and full face piece air purifying respirators, powered air purifying respirators or PAPRs can also be used where feasible. These alternatives will provide equivalent or higher protection than N95 respirators if worn correctly. NIOSH also approves other filtering face piece respirators that are at least as protective as the N95. These include the N99, the N100, the P95, the P99, the P100, the R95, the R99, and the R100. Again, more information about these strategies to optimize your PPE supply can be found on the CDC website.
Great. Moving on from switching gears to another topic, we've gotten some questions about special considerations for pregnant women who work in funeral homes. Is it safe for them to handle the remains of people who have died of confirmed or suspected COVID-19? And what about pregnant women just being around surviving family members who may be coming into the funeral home to make arrangements?
Funeral home workers should follow their routine infection prevention and control precautions when handling a decedent who died of COVID-19. We do not currently know if pregnant women have a greater chance of getting sick from COVID-19 than the general public, nor whether they are more likely to have serious illness as a result. The CDC has answers to frequently asked questions about pregnancy and breastfeeding on the CDC website. Pregnant healthcare personnel and surviving family members should follow the risk assessment and infection control guidelines for healthcare providers exposed to patients with suspected or confirmed COVID-19. So we do have, for both sets of those, I want to be clear, for the pregnant healthcare personnel and then also surviving family members, we do have information on the CDC website where you can go and look at a risk assessment depending on your specific potential exposure situation, and also to seek guidance on infection control measures. And adherence to recommended infection prevention and control practices is an important part of protecting all healthcare providers and healthcare settings. Information on COVID-19 and pregnancy is very limited. Facilities may want to consider limiting exposure of pregnant healthcare providers to patients with confirmed or suspected COVID-19, especially during higher risk procedures such as aerosol generating procedures, if feasible, based on staffing availability.
Great, thank you. A few moments ago, you mentioned some best practices for transfer of human remains. So when funeral homes take someone into their care, you mentioned use of proper PPE and some guidance about disinfecting the body bags. Are there any other best practices you would recommend for that?
CDC provides guidance for transportation of human remains in the guidance that we talked about earlier, which is the guidance for collection and submission of postmortem specimens from deceased persons under investigation for COVID-19. We recommend that you follow standard routine procedures when transporting the body after specimens have been collected and the body has been bagged. We recommend disinfecting the outside of the bag with products that are EPA registered and are effective against COVID-19, and to use those products in accordance with the manufacturer's recommendations. Just a note that there is information on our CDC website to get a list of those products that are EPA registered and approved to be effective against COVID-19. So I recommend that you take a look at that link and we can send that forward. We also recommend wearing disposable nitrile gloves when handling the body bag.
You've noted before that it's safe for people who are attending the funeral to be in the room with the body of someone who's died of confirmed or suspected COVID-19. Can you talk about any other recommendations for keeping guests and who are attending a funeral safe, things that our members and funeral directors should be doing?
Yeah, this is David. I can answer that. So three overarching principles that we sort of want to talk about with regard to keeping guests safe. One is just, as has been mentioned, in terms of interactions with the body, sort of limiting those interactions if possible and promoting proper hand hygiene. As you think about planning, so number two, if you think about planning for the event, again, limiting the number of people if possible, using live streaming options and perhaps having only immediate family on hand if possible, and staggering events. And then while you're at the event, promoting social distancing, cough etiquette, hand hygiene, and trying to limit as well number of other people coming in and out during that time period can be effective ways to help keep guests safe.
Great. So for Jewish families, you addressed earlier sort of some of the precautions that people should take where washing and shrouding the body is important, and guidance that funeral directors can provide to those families. But what about actually holding a service for Jewish families where it would be typically a closed casketed service with an unembalmed body? Are there any other further limitations on the number of attendees, or is the new guidance about limiting it to 50 sort of immediate family and then webcasting the service, would that still apply for those families?
Yeah, that guidance would still apply for those families, and it really would be also about, again, those principles of promoting hand hygiene and making that easy for people to practice at the event and after if they've interacted with the body, and promoting social distancing as well at the event.
Great. Can you speak a little bit about cleaning and sanitizing the funeral home? I know you mentioned earlier that there are specific products that you're recommending for cleaning the preparation room, where funeral directors would be working directly with the body, you know, embalming, clothing the body. But what about areas of the funeral home that are open to the public and staff? You know, the chapels, the arrangement conference rooms, restrooms, offices. What kind of cleaning protocol would you recommend for those spaces?
Yeah, so we're really recommending focusing in terms of what you clean on high-touch surfaces in those areas, trying to routinely clean those at least daily if you can. And when you clean and disinfect those, so obviously clean off any sort of visible soil or material using soap and water or some sort of detergent, and then use that EPA registered disinfectant that Captain Sugar mentioned, and there is a list as well on the website. The good news is that most of the EPA registered disinfectants are effective, but if you're looking for that list again, we will send that out on the website as well.
Great. And then a final question. Sometimes families request items that were in the casket with the deceased person be returned to them. You know, sometimes jewelry, things like a wedding ring or a necklace, other mementos. Do funeral directors need to be worried or concerned about giving those items back to the family members, or are there steps they can take to make sure those items are safe before they're returned to the family? Anything you'd recommend there?
Yeah, that's a great question. As was mentioned, we're still sort of understanding how long this virus survives on services, but sort of a best practice can be, if possible, to try and clean and disinfect the materials if possible again, and that would be something where you want to look up what the best practices are for that particular material, obviously given sentimental value, not wanting to ruin it, but again, if possible, clean and disinfect before you give it back to the family.
Great. Is there anything else that the three of you would like to add? Any other advice that you would recommend for our members?
No, not at this time. We just want to thank you all very much for giving us the opportunity to share this guidance with you today, and we hope it was helpful. Thank you very much.
Yeah. Well, thank you so much to Captain Sugar, Dr. Sarah Reagan-Steiner, and Dr. David Berendez. We know how hard you've been working since the beginning of this situation, and we thank you so much for your time today and helping our members understand how they can safely serve families during this pandemic. And we wish all three of you well as you continue your work to keep our country safe. for NFDA, we've been working really hard to stay in constant contact with folks like the CDC, the Department of Health and Human Services, and others about how you can keep families safe as you're caring for victims of this pandemic, caring for other families throughout this situation, and how you can keep yourselves safe. We know there are a lot of questions out there, and we're working the best we can to get those answers for you. We want to make sure that we're passing on accurate and reliable information. So please bear with us as we try and get that information out to you. We've been working on this nonstop. As we get new information, we're posting it to our NFDA COVID-19 page, so nfda.org/COVID-19. We're updating that regularly, so look there for the latest guidance and be sure to follow that. It's important to note that your state public health officials or local public health officials may have guidance that goes above and beyond what the CDC has recommended. And you should always defer to that state guidance, especially when it is a little bit more stringent than what the CDC is recommending. For example, we're hearing some things out of Nevada about perhaps recommending cremation for people who die of COVID-19. We are looking into that, and if we hear anything more, we'll certainly share that information. We've reached out to the state health officials in Nevada just to get some clarification on that issue. On that COVID-19 information page, we have the webinar we did last Friday with NFDA President Brian Hightower and embalming expert Wally Hooker. We will have this webinar up there, so feel free to share this out with your colleagues in funeral service. We also received this morning a really great video by embalming expert Matt Smith that offers some really good practical tips regarding embalming as well as transfers. So please take a look out for that video. Again, that page has the latest CDC info. It has other news and information about this COVID-19 pandemic. That page also has links to OSHA and the OSHA guidance on COVID-19. Certainly there are standards like the bloodborne pathogen standards and others that apply in this situation. You need to make sure that you are following those standards as well. We also have links to the Department of Labor and CESCO Management Consultants, which is NFDA's endorsed provider of human resources consulting services. There are certainly lots of questions out there as it relates to workforce issues, things like time off if you are ill, and paying employees if they should be ill, and how employers can navigate that. Take a look at the resources from CESCO and the Department of Labor to get guidance on those questions. And certainly if you're an NFDA member, you can call the CESCO Human Resources Hotline and get guidance on your particular situation. Again, thank you so much for joining us here today. We hope that this was helpful. With this new guidance on mass gatherings, we'll be working to get that up just as quickly as we can on our COVID-19 information page. So please stay tuned for that, and we wish you well. We wish for you to stay safe and to stay healthy as you go out and serve families. Thank you.